Thank you for joining. So can I just start by just seeing if anybody's got any specific questions, particularly about abdominal exercises before we get started, just to make sure I address that. So if anyone's got a question, they just want to pop off mute and ask me, then please do. Okay, so we will get started. If you have any questions as we're going through, keep it really informal, so just imagine that we're in the same room, and if you have any questions or anything that doesn't seem right, then we will just come off mute and ask me as we're going through. So we're going to come onto the floor. However, I'm going to demonstrate some things you can do in a chair and standing as well. So if you find getting onto the floor very difficult, then maybe just watch this, and then you can try it maybe in your bed at another time, or you can try some of the standing and seated options later on. So if we're coming onto the floor, we need to do it really safely. We need to do it in a way which is protective of our stomach. And a lot of people make the mistake of just kind of throwing themselves down and trying to pull themselves up. And that undoes all the good work that we're going to do. So I'm going to show you now a few exercises, predominantly on our back, on our hands and knees and on our side. You don't need a mat, you can just do them on the floor. And these are all appropriate for you if you've had surgery 2 weeks or more. They would be actually okay before that if I was supervising you and I could see you. So 2 weeks or more. If you've got a hernia, if you've had any kind of prolapse, if you've had any rectal surgery, all fine. These are all super, super gentle. So we're going to start by focusing on the deepest core. So I want you to imagine that your core is like an onion with many layers. And what you can see on the outside, if we think about our sort of six-pack muscles and then the kind of outer part of our abdomen, is the outer skin of the onion. And on the inside, we've got this deep core musculature, which is basically our diaphragm, our pelvic floor, and our deep core. You can't see it. It's right inside of your body. It's kind of like the deepest part of your core. And then from there, we then have these layers so that we end up with like an onion effect. So I want you to imagine now that we're going to go to that deepest part of our core. And this is really important because this is about reconnecting your brain with these muscles. And this is what we are finding helps to manage intra-abdominal pressure and helps to manage hernia risk and reduces risk of prolapse and just gets your core functioning correctly. Now, when we've had surgery, that core function becomes disrupted. So we're in pain, we may have been in pain for a while, we've got that trauma to the abdominal wall, and those muscles kind of switch off and they stop working. So we need to reconnect our brain with that. So let's get started. So we're going to start with a really simple breathing exercise. Come down to the floor really safely first. So we come down sideways. We lower ourselves down. I've got a little cushion under my head, it's just small. Our head is down on the floor, then we roll over. Remember, your head is the heaviest part of you. So we need to kind of try to avoid doing things with our abdomen that needs to pull our head up. So an exercise like lifting your head and shoulders would be a really hard exercise, and that would be one of the last things you do. So we're going to start with just breathing. So this is around reconnecting our diaphragm with our deep core. So to bring your hands around your ribs. And I just want you to take a nice breath in and feel your ribs expand. So this is lateral rib breathing. And then when you breathe out, feel the ribs come down. So we breathe in, the ribs go wide, we breathe out, and those ribs come down. So if you feel the breath coming into your chest or into your tummy, just have a little focus on thinking about sending it into those ribs. It's not always that easy. So just have another go. So as you breathe in, the ribs open like an umbrella. And then as you breathe out, the ribs are coming down and together. So a nice flow breath in and out. Just practice that a little bit. And keep doing that as I keep talking. So what we don't want is when you breathe out, this kind of like huff of breath, and then you poof up your belly. So it's not like we're swapping the air from our ribs to our tummy. All we're doing then is increasing pressure around our abdomen, particularly around the stoma. So we want to as we breathe out, we want to think about flattening our tummy. So we're not moving, there's no pelvic tilting going on, it's just breathing. So breathe those ribs wide, breathing out, and as you're breathing out, feel like you're pulling your ribs down and flattening your tummy. And see if you can get that feeling of everything starting to flatten out. The ribs connect and you get a flattening. Now let's take it one step further. So I want you to imagine now you have got a string between your rib and your opposite hip bone, and it's inside you. So when you breathe out, that string becomes tauter. So the string is between your rib and your opposite hip. As you breathe out, the ribs come down and you feel like that crossover of muscle just becoming stronger inside, like you're tightening up those two strings. So have a little go of that. So you really have to concentrate. Breathing in, breathing out, ribs coming down, and see if you can create an imaginary string and tighten those up like a cross in the front. And just try a couple more of those breaths. So this is not easy, okay? This is around reconnecting your brain, and people kind of done this, had this done for many years, and you get to this and it's actually quite challenging. So if you're doing it, just make sure your knees are bent and your feet are flat. And we're breathing in, do one more. Into the ribs. Ribs come down and the belly flattens. Okay, now let's see if you are actually able to connect that deep internal core. So find your hip bones here at the front. So there's kind of that crest of your hip bone at the front. Bring your fingers into your tummy, so you're going to actually have a little feel of the muscles right in your abdomen. So I'm kind of like on the edge of my stoma bag, and I'm just in here. So this time I want you to see if you can feel the muscle firm under your fingers right at the end of your exhale. You might not, so don't worry if you don't, but if you do, then great. If not, it's something to practice. So we're going to take that breath into the ribs. We're going to breathe out. The ribs flatten down. Keep breathing out, and see if you can feel the muscle under your fingers. You want to consciously try and tighten it, like you're putting your hip bones together. And then relax everything and try again. So nice inhale. And then exhale. Ribs come down. Keep breathing out all the way. Long exhale. And then feel like you're tightening those hip bones together. And see if you can feel the muscle become taut under your fingers. You might need to sort of poke in a little bit and just have a bit of a feel. And just see if you can get that connection. So what you're doing is using your brain and the breath to create a contraction of that muscle. If you can get that, then that's a really good tick box to say you're ready to move on to some other movements. If not, then practice, try some other movements and see if it helps. Okay, so let's move on from that. If you didn't get that, don't worry, it will come with practice. So what you're doing now is contracting the deepest layer of abdominal muscle. So now we're going to try a pelvic tilt. So I want you to come into this nice relaxed position as you were. If you've not moved, don't move. If you've not changed it. What we're not going to do here is kind of jam the back into the floor, because what that does, it increases intra-abdominal pressure. Intra-abdominal pressure will always go to the stoma point or any incision site. So we need to reduce intra-abdominal pressure. So in the fitness world, there's a big trend to push your back into the floor. We don't want to do that. So if any instructor or you read that anywhere, just please don't do that. What I'm going to teach you now is a pelvic tilt, which is a very different movement. So we're going to start with our hands like this. Thumbs together, fingers together. And we're going to be in a nice diamond shape. And we're going to place them on our lower tummy. Now I want you to imagine that inside your diamond, you have got a marble. And that marble is going to roll towards your thumbs and it's going to roll towards your fingers. So we're going to take that nice breath in again, breathing in, breathing out. Now, as you breathe out, you're going to roll the marble towards your thumbs and your pelvis does a little tilt backwards. So not a jamming into the floor, but a tilt. And then you release and come back. So we take a breath in, we tilt, breathe out, roll the marble to your belly and come back. Good. And again, breathing in. And then exhale. As you exhale, that's when we roll back, the ribs come down and you feel this scooping feeling and a flattening of your tummy. Now be sure you're not pressing with your legs too much. Have another little go. So it's very subtle and it's much smaller than most people try and do. It's very subtle. Initiate it with these deep abdominals. So we inhale and we exhale and we do the tilt back. The exhale is really important because the exhale activates the diaphragm and it creates more space, so it reduces intra-abdominal pressure. We'll try one more. So remember, all you're doing is rolling that marble to your thumbs. Your back will flatten, but you're not pushing it into the floor. And then release and let it go. So that's our basic pelvic tilt. So mistakes people make there is they push with the legs, they come up too high, so your bottom is lifting, or they jam the back into the floor. So it's very subtle, very small, quite gentle, but quite specific. So we need to really get that tuck and draw in. And if you're really tuned in, you can start to bring the pelvic floor in a little bit as well. So as you do that tuck, you're going to feel a connection with the pelvic floor and those deep abdominals. Slow, controlled, specific, okay? If that's tricky for you, I'm going to show you a standing version of it at the end as well. So let's come on to our side for a moment. So just roll over, keeping your head down. I'm going to do a breathing exercise on our side. So a similar type of thing, but this is teaching us how to relax the abdominal muscles and how to then contract them when we choose to. So we're going to bring our hand onto our belly. Just kind of give it a cuddle. And then we're going to completely relax. Everything's just totally chilled and relaxed. And then we're going to breathe in. When we breathe in, you're going to feel a little bit of rounding of your belly. And then we breathe out. And we draw the hands in and draw the belly in. So it's the opposite breathing, what most people will want to do. So you breathe in and soften, the belly gets bigger, and we breathe out and the belly draws in and your hand will come in with it. So this is a really nice one to do on your side in bed, and we give this to patients even just a few days after surgery, because what we're doing is just starting to wake up that neuromuscular connection between the brain and the deepest abdominal muscle. So keep practicing that. Breathing in to round, breathing out to draw in. So with all of these things, you can practice the pelvic tilt, you can practice for like 12 repetitions or a minute maybe if you're doing it nice and slowly. Now, depending on which side you are lying and where your stoma is, you're going to find it different depending on which side you are. So do both sides and experiment with seeing how it feels. So all you're doing is breathing, rounding, not forcing the breath, letting the breath enlarge your belly. And then breathing out and drawing that in. Okay? Let's roll back onto our side, onto our back carefully. So keeping our head down, we come over. Right, now we're going to challenge the stability of this deep core a little bit more. So we're going to bring our knees together and feet together. And this is an exercise called knee drops, okay? Not knee rolls, that's different. I'm going to do that one as well, but knee drops. So this is where we get that connection and contraction of these deep abdominals, and then we challenge it with a knee movement. I'll show you what that is, and then I'll talk through the whole exercise. So the knee movement is just allowing one knee to part, it taps away, and then it comes back up. And then we go to the other side. So that knee drops across and back up. So what we're learning to do here is bring contraction into that deepest core, hold it, and then challenge it. On the surface, this looks like a really easy exercise, but when you do it with real intention and concentration, it's not. So let's set ourselves up with connecting this abdominal muscle first. So we're going to breathe in, we're going to breathe out, flatten the belly, feel that connection, and if you can feel a bit of flattening and tightening here, then that is great. Now, just allow one knee to just drop away from the other knee, super slow, only about halfway down, and then bring it back up. And then go to the other side. Now your job is to keep your hip bones absolutely still. So imagine you've got a couple of glasses of champagne sitting on those hip bones. Don't hold your breath. Keep this muscle contracted and really strong and firm. Keep that going. And you might get to 6 of these and think, that's starting to feel quite tired, this muscle. And then what you do is you just stop, you take a moment, reset, and then we go again. So see if you can get contract. It's all about contraction and a very slow movement. I see people do this all the time and they're trying to get the knee to the floor. This is happening. That's not what we're looking for. We are looking for small, precise contraction. Now we don't want like a bracing and a bulging. We want enough contraction to keep your pelvis still. So let's try another 6 reps. So we're going to take a breath in, breathe out, connect the muscle, control. Now allow our knee just to part halfway, keep the hips still, bring it back up. So this is a super exercise. It's safe, there's no abdominal pressure. We're starting to build endurance into the muscles. This is now moving into a strength exercise, but it's really safe. There's no pressure, you're not increasing your risk of hernia, and it's a super simple, safe exercise. For those of you with hernias, this is super safe and simple as well. Well, it's not simple actually, it's quite difficult, and you might be finding it quite challenging. Have a little, do 2 more. Keep the pelvis super still, keep focused. 1 more. Good. And then have a little rest. Brilliant. So, next exercise is very different. So this one is more around using some of those outer layers of our onion. So we're starting to add a few things in to mix things up a little bit. So we've established we've got good core connection. And we're going to sort of start to move a little bit. So keep our knees together and feet together. Arms come out a little wider. Keeping our shoulders sort of to the floor, not glued, but they're firmly on the floor. We're going to allow our knees just to move over to one side together. Now we don't want to come all the way to the floor, just a little bit, and then come back to center, and then go the other way. So you'll see my feet stay stacked. So you want to super glue your ankle bones together. So don't slide as your legs come across like this. We keep those feet together and back up. So shoulders stay down. And we're just coming across gently. Now then, as we start to do this, bring a little bit more intention to using the waist. So as we draw the knees up, the waist muscles are working a little bit more. So use the obliques on this side to bring those knees back up as you start to feel a little bit more confident with this movement. So again, this is one we give to people, and it's recommended by the Stoma Nurse Association, 3 or 4 days after surgery. Now, you might be thinking there's no way I could have done that, but very small, tiny little knee rolls in bed like this is really appropriate. So just see how that feels. Now thinking about the breath, we just don't want to hold our breath too much here. And have a rest. Okay, so I'm going to show you 2 more exercises, one on our hands and knees and one out using a chair. So roll over sideways with care, coming over. And then if you can't kneel for any reason, if you've had a knee replacement or it's particularly uncomfortable for you to come into an all fours box position, then just watch this and I'll show you the standing version. So we're going to come into a nice box position like this, okay? Now if you've got a very large hernia or you're very just newly post-surgery, this can feel a little bit vulnerable because suddenly gravity is pulling your abdominal wall to the floor. So we need to think about using these muscles in here, just draw them in a little bit. So we're going to practice that. So we're going to take a few breaths. First of all, just make sure you're in a nice box. So your hands are under your shoulders, your knees are under your hips. I'm just going to take a nice breath in and allow the belly to round, and then we breathe out and just draw those abdominals in. So we're flattening the back. So we're not just in a saggy box, we're in a nice strong box, activating the abdominals. Now we're going to do a pelvic tilt in this position. So all we're going to do is tuck the bottom. So tuck the tail under and then release. So you see how tiny that is? This is not this, right? That would be a big cat stretch. So we're going to start with a tiny pelvic tilt. So we breathe in and we breathe out and we tuck and we scoop these abdominals up and away. We release and again, inhale, exhale, tuck. Now don't try too hard with this because what I see with a lot of people is they're kind of like pushing forwards. Keep the legs straight so the thighs stay where they are, and all we're doing is doing this little tiny box tuck and we're activating these deep abdominals. So we do it on the exhale, always on the breath out. Little tuck and release. Cool. So again, with all of these, it's aiming for something like 10 to 12, or as you can tolerate. If they're feeling really simple and easy and you're like, if that's okay, do them for a little bit longer or do 2 sets of 12. I'm going to show you a standing version of that, and then we'll have a little chat and you can ask me any questions. I'm just going to change my camera position. Okay, so if you want to do the pelvic tilt with a chair, say for example you can't come onto your hands and knees, all we're going to do is just lean forwards over the chair, have our knees, feet apart, knees are slightly bent, and we're just going to kind of allow that bottom to stick out. So you're now replicating that same body position as you had on the floor. Same thing, we just breathe out and we tuck. So it's just this bottom end, we tuck up and under, we release, we tuck. So it's very much a scooping. You're not pushing forwards like this. Keep the legs still. And it's like as if you've got a torch on your pubic bone, which is a bit weird, but stick with me. And you're kind of trying to shine it and point it onto the wall, and then take it back down and shine it up. So that's a nice one you can just do on the kitchen worktop. Quite nice for your back if you've got a bit of back tightness, which a lot of people do after abdominal surgery. Even if that was years ago, it can still, these are all exercises that we start with, whether your stoma was 2 weeks ago or 20 years ago. If you've never done this kind of work, this is where we start. Even though it's simple, gentle, seemingly quite lame to a lot of people, you do have to concentrate and use your brain. So there we are, there's a very small introduction to some very gentle movements that are appropriate for everybody. That's where we start, and then we build on those, and we start to build strength and we build endurance. But that's building function and restoring coordination. So has anybody got any questions or thoughts on any of that? If you want to come off mute or just pop it in the chat box. Let's see if I can find it. Okay. Anybody got any questions? No.
Hi, can I ask one quick question? Hi, sir, can you hear me?
Just about.
Sorry, good afternoon, that was brilliant, thank you. I'm just wondering, did you say earlier on if you don't wear your, like when you're doing your Pilates classes online, is it better not to wear the support belt all the time just to get used to doing like, you know, like you're getting, is it better not to wear it? Like, is it better not to wear the stoma support belt when you're doing your exercises? Like you're getting
Yeah,
full benefit.
so it really depends on how you feel. But it depends, and it also depends on how tight the garment is. But if you're really trussed up in a lot of strong support wear, you can't feel what the muscles are doing, and it really will impact your movement quality when you're trying to do really subtle movements like that. So certainly for the exercise where you're lying on your back, I would completely recommend to try it without if you feel you can. I mean, I tend to wear high-waisted, like yoga stuff, so there's something there to support the bag, but I wouldn't necessarily recommend wearing a very strong support garment, even if you do have a hernia, because we want you to feel the muscles. And Tina, who I was talking about in the case study this morning, she, for the first few weeks, she did wear it until she had the confidence to take it off, and then she realised that she was feeling the muscles a lot better when she wasn't wearing it and got more out of the exercises. So that's certainly my recommendation. Yeah.
Perfect. Thanks, Maria.
No problem.
And if you can, you basically use, can you use like say a Pilates ring, or like if you're doing like those sort of exercises, would that be too much? Like a Pilates ring, you know, to put a between in your legs. Like if you're using any sort of weight or anything like that, like is that would you be okay then as well? Like it's better also to start maybe with Pilates, build the core, and before you start going into doing small weights or whatever. Like build it up.
I didn't get much of that, Linda. Just summarise that really quickly again.
So yeah, so I just I'm thinking about doing weights, lifting small weights as well, but you're probably better starting off with the core, building that up, and then moving slowly into weights then after.
So
build the core up first.
Yeah, so if you're going to start adding equipment to a class, such as small hand weights, and you can see those little balls behind me, or small hand weights, or a Pilates ring or a Pilates ball, I would get the basics right first, because that is all about making things a little bit more challenging. Get the basics right first. The only thing I do use in almost every class is one of these, a Pilates ball. And that's not to make things harder, it actually makes things easier. So what we do by this is we use this to change the position of the pelvis, and sometimes we can use this as a band as well. And these are kind of aids to make things easier sometimes, so rather than making things harder. But a ball and a ring, or weights and a ring, will make things, like they're challenges to a standard Pilates class. Get the basics right first. But not every Pilates class is going to be stoma friendly. We want even a beginner's Pilates class, if it's not a clinical physio-led Pilates class, the chances are it's going to be too challenging. So we need to be really mindful and careful about what we choose and where we go. You know, I do all of mine online, so if the classes are and the timings work, you can come here, and then once you learn what to do, you can then take that to another class and kind of modify yourself. And that's a really good way of doing it.
Great, thanks so much.
Thank you. Anybody else got any questions? Any more questions? Maury, yes. You're waving at me. Hi.
I am. I've got a couple of questions. One is, I'm in my 70s. Mm-hmm. I've got arthritis in my hips and my lower back.
Okay.
Is this something I should be doing?
So how mobile are you, Maureen? Are you able to get onto the floor, and are you able to sort of move around, or is it just a bit uncomfortable?
I've got onto the floor. I'm finding it difficult to follow what you said because I can't see the computer at the same time.
Oh, okay.
So that was my second question: is it going to be on the website so we could maybe, do things in our own time?
Yeah. So there are some on my website. So not the IA website, but on my website, there are some pre-recorded videos. So with that, you can pause and you can then repeat and follow. And then once you've got the hang of it and you're familiar with the exercises and what I'm teaching and my teaching style, then it'll be easier for you to come into class. In terms of arthritis in your hips and back, I would say do what you can, do what feels comfortable. We know that with arthritis, wherever it is, keeping the muscles strong is one of the most important things you can do. So anything where you can keep moving, even if it's a bit uncomfortable, is really the advice. And to try and get the muscles strong around the hips, and that's exactly what this type of Pilates will do. So it should be safe and appropriate for you. So it kind of depends on sort of on whether you're having any well, how comfortable you are getting onto the floor. There are classes, not mine, but there are classes.
I can get onto the floor. Sometimes it's getting up off the floor again.
Well, have a chair next to you to help you get back up. So have things in place to help. But definitely, I would say yes, very appropriate for you with hip and spinal arthritis and knees for sure. Do what you can within a class. There's lots of modifications. Try the pre-recorded videos first, because you can then pause and do them in your own time. And if you wanted to come to a class, this is like a little quick taster today. So the class is generally a little bit slower paced, so it might be right to keep up. And if someone can help you get it so you can see me, that might help as well.
Thank you very much.
Pleasure. Anybody else got any questions? Nope. Okay. Well, thank you.
Can I just say, can I say one thing, Sarah? I just read, because I got your book. I don't have but I have IBD. But I have to say, the section where you learn to breathe out when you're lifting, sort of like rather than holding your breath. I was doing it like wrong for so long. When I read that in the book, I was like, I need to change that because
great.
Yeah.
That was a bit of a light bulb moment, was it?
It was a light bulb moment. Thanks very much.
Brilliant. Pleasure. All right. Nice to see everybody.
Bye-bye.
Take care. All right.
Thank you.